doing an arm, the most important place in terms of what the patient is concerned about is this lower part that's hanging down. But what's all equally important, I feel, is this fat pad that's on the side here. And in most females, they have a fairly large fat pad here that you want to come around and take out. And this is why it's very difficult for females to get any triceps definition. They have a very thick fat pad right over this triceps, so that's what we like to take out too. You can actually do other parts of the arm as well, but certainly she doesn't need it here. She's very thin. So basically the posterior part of the arm and then this lateral part we're going to do. So arms are a very rewarding area to do. They don't tend to have a lot of post-operative swelling, and what they do have tends to go down fairly quickly. You usually don't have to use any kind of light compression more than a couple of days at the most. Same thing on this arm. We're going to do this posterior aspect and then this lateral fat pad here. I think that'll give her a nice contour. And when we're done, in a couple weeks, she'll be able to see, she can flex this triceps and you'll be able to see the three heads of the triceps there, and that's really what's going to make it a very nice procedure then. So, in our previous cases, we've used a Sciton Joule laser. Today I'm going to be using a different laser. I'm going to be using the Sciton laser. I like this laser particularly. It has two wavelengths instead of one, 1064 and a 1319 wavelength. It also has a much higher fluence, or much higher power, which in turn allows us to move much more quickly. The cases are shorter. That takes much less time to do the procedure with this laser. So today you'll be seeing me use the Sciton laser. The first part of this is basically the anesthesia, as you all have seen me do before, some of you. And the tumescent anesthesia, we're going to make some couple little teeny tiny incisions here at our elbow and put some fluid in there, which will numb all the areas up for us. You'll see it kind of puff up as we put that fluid in there, and it's creating the anesthetic effect. The laser, we got her numb now. We're going to start. We're going to do the laser on the arms. Noted earlier, we're going to be using the Sciton because of its two wavelength and higher power settings. This is just the aiming beam. You can see this under the skin. First of all, it tells us the laser's on, number one. Number two, it gives us an indication of the depth we are in the skin, because you don't want to get too deep with the laser. You want to stay relatively close, particularly if you're using it for skin tightening effects. So we want to be up closer to the skin. That gives us an indication of really how deep we are. As long as we can see that light, we know we're relatively superficial. Suction cannula. We're going to take the fat out now, and she's completely numb. Actually, you can see the color change there, how white that is. That it tells us that she's got a good vasoconstriction, or your blood vessels were shrunk down there, so we don't have to be concerned about bleeding, and we're just going to go ahead and suction the fat out now. She won't feel anything. She just knows I'm moving around. When you see these, it always looks like you're just torturing somebody, but you're really not. They don't feel any of this. They just know there's movement. The anesthesia is so complete, so effective that there's really no sensation on their part other than just movement. Another question I'm often asked is, why do you have to move so fast? And you really don't. Everybody kind of has their own pace when they do this. I do it quick. I've just done it for so long. It's got to be very natural movement for me, and I move very quickly. But you can do it slower.